He's going to, and thanks for accepting the talk at short notice. He's going to talk about the new corneal drug delivery systems.
So if we close the door so that no one can leave, because this is a dry topic, uh, things which are so new that even I have not heard of them before preparing for this talk. Okay, so we are aware of the problems that we have in the ocular surface, that we have a hydrophilic surface, so it welcomes things which are hydrophilic, but most of our drugs are hydrophobic, the effective ones anyway. So we need to ensure that the drugs reach the ocular surface and get into the epithelial cells. And the various polymers have been found. So these are some polymers which are called mucoadhesive polymers. So they come and stick very well, and they have enough time because they are there, so they can slowly elute their contents. They're biodegradable and non-biodegradable. You get two types. The importance of whatever polymer you're using should have good viscosity and adherence value, and a reduction in the drug drainage rate. The drug should not drain too fast. And some of these drug carriers, they attach themselves, they have a mucin coat outside, so that the mucin layer will love them, hold them in place, and then it can slowly, so it improves their residence time and establishes a contact between the drug and the tissue. Some of the newer polymers with unpronounceable names are the ones which you can read. I won't delve into the details because you will forget them 30 seconds after this slide moves. Then you have medicated contact lenses. This has been around for some time. They can provide a controlled or sustained release of medication. So in theory, it sounds very nice. And you have now nanoparticle laden lenses. Lenses with nano is really a new buzzword in drug delivery systems. We'll hear a lot of nano in the next 6 minutes. So these are biomimetic and imprinted contact lenses with layered structures, causing an extended drug delivery along with improved availability and reduced side effects. So if you have a contact lens which elutes the drug, then you need about 80%, 20% less to achieve the same effect. Then you have ophthalmic inserts. Now this was tried decades ago. I remember those lacquer certs which came in, and it fell out of favor because they were irritant and the dissolving rate was unpredictable. So now there are some newer ones in the pipeline which are non-irritant, non-toxic, and actually effective as well. And they use polymers like polyacrylamide and the one which we are familiar with, which is PVP. Then the other one which has been around for a couple of decades is iontophoresis. So it can be transcorneal or transscleral. A weak electric current is used with a ground electrode somewhere in the body. However, it's never come out of the research labs because of several disadvantages. You can get epithelial edema, burns, you're using an electric current, damage at the site of the application, and you can't push drugs which have a larger size. So you need those with low molecular weight, small drugs, small size drugs. And then we come to as I said, the new buzzword, which is nano. I always thought that nano means small and that was the only thing. Only when I was researching for this, I found that there are different, nano is also, there are many variations in nano. So let's try and make it a little simpler. The size of different nano formulations is usually below 1000 nanometers, fabricated through chemical process. So this is common to all nano formulations to release their therapeutic agents and to enhance penetration. Major advantage of utilizing nano carriers is it improves the bioavailability, and it achieves a controlled release and a targeted delivery. So you can decide where the drug is going to reach and then deliver. So they offer higher drug retention time, lower dosage requirements. In other words, they seem to be just the perfect things for us. How does it work? The cornea and the conjunctiva possess negative surface charges, and that enhances the retention time of any positively charged nanoparticle. So if you can create a nanoparticle which is positively charged, the cornea conjunctiva being negative will hold it more efficiently than those which are anionic, and therefore it will give an increased opportunity for the drug to enter. So the first one I'm talking about are nanomicelles. These are amphiphilic. I learned this as a new term. Amphiphilic means hydrophobic and hydrophilic at the same time. Very small, 10 to 100 nanometers in size. Now, these nanomicelles consist of a hydrophobic core. For example, cyclosporin drug is a hydrophobic core, and the drug is confined in that hydrophobic area, but it has a hydrophilic tail which protrudes to the outside environment. So you can see that these are micelles and micellar emulsions. So nanoemulsions, now the variation nanoemulsions are thermodynamically stable, little larger, 10 to 1000 nanometers, interfacial surfactant layer separating the oil and the water. So these drug carriers can be oil in water, water in oil, or a continuous spectrum, and they allow the entrapment of hydrophilic and lipophilic drug particles both. So hydrophilic and hydrophobic, which is lipophilic, can both be incorporated if it's a nanoemulsion. Then you have nanocapsules. Nanocapsule is something like the Sequa, which is just being launched by one of the companies. The drug is enclosed inside a protective matrix with a size which is very, very small, 10 nanometers. The drug is now entrapped inside, it's adsorbed or dissolved into the matrix system. It improves the bioavailability. So there is an outer coating, something like an orange fruit. So you got the coating outside and the active drug which is inside. The amount of drug required is very small in these cases. So what happens is this capsule, then when it reaches the ocular, it's hydrophilic, so it goes right down to the ocular surface, the epithelium, and then that capsule, if you again imagine the orange fruit, the capsule just dissolves or disintegrates over there as if like a programmed time bomb, and the micelles which are inside, which are hydrophobic, can penetrate the epithelium and cause their desired effects. Then there is a variation called dendrimers, which are symmetrically shaped nanoparticles, and they have a hollow core which encapsulates the drug. So this is a dendrimer has a core which holds the drug into place, and you can either enclose the lipophilic. See, lipophilic is the issue. You want that lipophilic moiety to go down. So you have a hydrophobic cavity, you have this lipophilic material which is inside, and the drug is attached to this hollow core, the dendrimer. So you can see that. Then you have hydrogels. Hydrogels are highly absorbable, natural or synthetic polymers as a three-dimensional framework. The flexibility is achieved by providing sufficient water there. When they're exposed, the three-dimensional cross-links render these structures ordinarily insoluble in water when used in topical formulations. Therefore, they adhere to the mucus. There is good mucoadhesiveness, and it increases the residence times. New words for us: neosomes. Neosomes are prepared by self-assembling the hydrated non-ionic surfactant molecules to form bilayers. So 2 layers. Medication is encapsulated. Again, the whole principle is the same. You have 2 layers. Medication is encapsulated inside a vesicle surrounded by the bilayer. So it's a non-ionic surfactant. I told you there were 2 types. You could have an anionic, positive and negative, but you can also have a non-ionic like this, cholesterol and a charge-inducing molecule. So various ophthalmic drugs are being tried by some of this, and the first cousin from the mother side of the neosomes are the proneosomes. They are free-flowing, which on hydration become the multilamellar neosomes. So it's basically like a pro-drug thing. Why does it work? Because it improves the shelf life of the loaded moiety. So I have tried to encapsulate my talk on newer drug delivery systems, and whatever I understood, which is about 60% of this talk, I have tried to make you understand. Hopefully about 30% has gone in. The important thing to remember is that it is difficult to give talks like this, but it is difficult for the drugs to penetrate with no matter what the pharma companies tell you, to achieve penetration. So they all tell you about how the microemulsions and we've got nanoparticles. And now we know that nano doesn't mean nano. There is lots of varieties even in the nano. And we are still far away from achieving the optimal drug delivery system. That means you put a drop there and it goes straight to the optic nerve and stimulates it so that no more optic atrophy. So we are nowhere near that zone yet, but we are trying to see that at least drugs can penetrate through the tear film that we have and reach at least the epithelium and retain there and stay there for some time so as to achieve their effects. Thank you so much for your attention.
Thank you very much, Dr. Maskati. I think, as usual, you made this topic easier than it sounds. Just I had one quick question about the neosomes and the other nanoparticles that they retain for a longer time. But can they achieve the dose that is required, the concentration that is required?
They're doing a lot of work on both the neosomes and the proneosomes, and the initial results are encouraging. That the first prototypes which were there were not able to achieve the concentrations, but the newer ones which are coming in, they're improving the retention time and the concentrations that they want. Yeah. So I think they will be the future. I think the dendrimers and all will go, and we'll be left with the nanomicelles and the neosomes and the proneosomes. Yeah. Thanks.
Yeah. So for the practical use of clinicians, I think we have nano tiers that is available. Then the cephalosporin, which is quite popular as restasis, which is an emulsion, and now we have the Sequoia. What is the difference in the
Yeah, you see, nano just means small. So if a particle size is less than 1000 nm, it's called a nanoparticle. Now, you can have a nano micellar thing. That means a drug which is with a tail. You can have the sequa type, which has got a outer coating which protects it while it goes in. You can have just the fact that it's a nano emulsion. That means it's very small particles in an emulsion. So there are variations in nano, and everyone just tries to promote that ours is a nano. Even the nepafenec type of drugs, that ours is a microfine emulsion, and then the words are used interchangeably. His is a microfine emulsion, mine is a nano emulsion. So it doesn't really mean, and nano just refers to particle size. In nano, you can have, as I said, emulsions, micelles. So you need to go a little deeper into how exactly it is doing its work. Thanks.